Welcome to Advancing Health. WellSpan Health is a 9-hospital system serving mostly South Central Pennsylvania. Its 23,000 employees collectively serve more than 1.5 million patients per year, aiming every single day for a goal of 0 patient harm. In this podcast, we learn more about how WellSpan relies on tiered daily huddles to provide the best patient experience possible. Not only clinical team huddles, but also frequent conferring among safety and security teams, as well as cleaning staff. WellSpan's philosophy is simple. Everyone has a part to play. Your host is the American Hospital Association's Chief Physician Executive, Dr. Chris DiRienzo.
I'm Dr. Chris DiRienzo, and I am super excited to be here in York, Pennsylvania. We are on-site visiting with the WellSpan Health System. With me today is Dr. Carlos Roberts. He is a urogynecologist, and he is the Vice President and Chief Medical Officer of the Women's and Children Service Line. Carlos, thank you so much for joining the podcast.
Thank you for having me today.
Well, thank you for having me. The reason I'm here in Pennsylvania this week is I get to join the award ceremony for your service line, and there is much to celebrate. We've gotten to tour the practices, we've gotten to tour the hospital, and you have outcomes that just knock it out of the park on all manner and variety of fronts. But the one thing that we really wanted to engage in the podcast today is about your safety huddles. As part of our patient safety initiative, we are identifying folks all around the country who have these leading practices, and doing the kind of tiered safety huddles that you lead at WellSpan is certainly one of those practices. Tell us about it.
So we implemented safety huddles about 3.5 years ago, and it was a way for us to work towards one of our most important initiatives as a health system, which is working towards zero harm for all of our patients and our team members. So the zero harm efforts are not just about patients, but it's also about harm to our providers and staff as well. Those tiered huddles are very structured, and it enables us to, one, identify any kinds of problems that we might have or opportunities for improvement, and two, escalate it to the appropriate levels in the hospital or the health system through this tiered structure. And we have several different levels of the tiered structure.
Let's talk about those levels, because I got to join a couple of those today, but where do these huddles start out?
So we have tiers 1 through 6, and the very first level of the huddles, which is tier 1 huddles, occurs where the work is done with the providers and the staff. And what we do is we identify any opportunities for improvement, either with patient safety concerns or with processes. And then we elevate that to the tier 2 level. The tier 2 level is the level where we have managers of those different sites involved in that practice or inpatient facilities. Then if there is something that needs to be escalated, then it's taking up to the tier 3 level. The tier 3 level is where we have the directors of operations. So the operational leaders, along with individuals like myself, engaged in hearing and understanding what the challenges are, and then identifying things that may need some barriers to be broken down at levels above where I am. We then take it to the tier 4 level, where that's where the vice presidents of the service lines or the hospitals operate at. And we then share things through what we've heard from our tier 3 and tier 2 and tier 1 folks that need to be escalated.
Let's pause there for a second, because through 4 tiers, we've now started, as you explained to me, in the NICU itself on tier 1, or in an individual ambulatory practice, or even other non-clinical team members in hospitals and across the health system. Is that right?
Yes, that is correct. And so one thing I want to share with you too. So in my role, and anyone who's in a similar role across the service lines or the entities or the health system, my first order of business as a chief medical officer is to look at what we use as Press Ganey. And you see populated view what has transpired over the last 24 to 48 hours. And what we get is sort of a report that allows us to identify if there's a serious harm event that we need to prioritize. Now, we encourage every team member to report, so we rather over-reporting than under-reporting. So I already come to the huddles with some kind of understanding that there's some events that may have occurred, some more harm than others, some may be more or less concerning, but I already have some base knowledge. So once I come to the huddles, then I get the essence of, all right, what is the OFI that has occurred? And what have we done so far to try and mitigate any further challenges?
OFI being opportunity for improvement, which everything that we do in healthcare is just driven by this relentless drive to improve. And again, so we've talked, starts at tier 1, goes up through tier 4. I want to pause there for one more second, though, because these tier 1 huddles, it sounds like, aren't just happening in practices, in teams. What are some of the non-clinical areas that are having same kinds of huddles?
So our safety teams, security teams, they have same type of structure.
Really?
To ensure that they too are engaged with the entire platform to make sure that we're delivering care to our patients in a safe way. Because the fact of the matter is we're all together caring for our patients and team members in one way or another.
Exactly.
We even have it for our cleaning staff. So one of the things that we've done with our cleaning staff is ensure that they understand that their role is not about cleaning rooms or about cleaning the hospital or the elevator or the stairs. It's actually about decreasing infections.
Yes.
So when we change the perspective of how they view the job that they are carrying out, it allows us all to be aligned with reducing harm in the hospital and trying to achieve our goal of zero harm.
And when an entire team, from the folks who clean the rooms to the folks who are operating in the ORs, are aligned in that way, there's some real magic that can happen. And y'all are doing that at 9 hospitals and countless ambulatory sites. But tier 4 is not where it stops. So what happens? We started, early in the morning, some places at 6:30, because that's when their team members come in, some at 8. So we're through tier 1, tier 2, tier 3, tier 4. Now, what happens next?
So from the tier 4 level, that's where the most senior person at that level is someone like myself, a vice president and chief medical officer, or a vice president of operations. Those individuals then go and participate in the tier 5 huddles. And we have to now bring information from the previous huddles that are important to share at that level. And what we have at that level now, the highest quote unquote ranking person at that huddle is one of our senior vice presidents.
Okay.
And so after we share information at that tier 5 level, our senior vice presidents then take that up to the executive level.
So that's a tier 6 then?
Yes.
So what you're sharing is that something can happen at 4 o'clock in the morning somewhere, and by 9:30 a.m., the entire health system will have been briefed, and you can be taking action right away.
Yes, absolutely.
That is spectacular. But it's not only, I think this is really important to remember, because health systems like WellSpan that are so driven to improve, if you don't remind yourselves of some of the things we need to celebrate, then you can lose the energy in that flywheel. And as I got to hear this morning, these huddles don't just focus on where can we improve, they focus on what should we be celebrating. And so how do those celebrations translate all the way up to the leadership team as well?
Yeah. So, just to give you kind of an essence of how we have that huddle structured, we always start with sharing our common goal. Our common goal is working towards zero harm for 23,000 team members and our patients. And it's an opportunity for us to work towards that zero harm and also to share things in an open way without concern about retaliation. So once we set that as our bar for operating, then everyone comes to the table sharing things. Then we kind of bucket things. We bucket things into, do we have any safety events? Do we have any operational challenges, call-outs or providers that are ill?
We saw that today. We happened to be in York, Pennsylvania in the midst of a snow and ice event. And so there were some serious operational challenges as roads were iced and folks couldn't get places. But I got to hear you using those huddles to make sure that we're redeploying resources, we're calling patients. And when you serve 1.5 million patients a year, that is a challenging process.
Absolutely. Now, one component of that huddle is also celebrating the wins.
Excellent.
So we encourage individuals to come forward with celebrations. And we don't just come forward with the celebrations, we then circle back with the people who we're celebrating and thank them for all the hard work that they're doing.
Closing that loop is so important, both when there's something concerning. If I'm a team member at WellSpan and I know that if I get this into that reporting system, there's a cycle and a process where we not only look into it, but it can get escalated and then get brought back down with follow-up. And doing that on the celebration side is so terrific as well. You were sharing with me as we were walking through one of the elevators, the notes that you get to write, recognizing folks whose stories have been heard at that senior leadership team level. It has been a privilege, Carlos, to get to spend some time with you. Obviously, you've got something very special going on here at WellSpan. If there's just one more thing you would want to leave our listeners with about what makes you all such a spectacular health system, one that AHA has recognized in our quest for quality process in years past, what would you want your closing thought to be?
So what I would share with other hospital systems is that if you change your focus to the patient and working towards ensuring everything that we do for that patient results in them having the most favorable experience and outcome, then all of your work would be focused in that direction with all of your team members. And that, in essence, is what's going to give you the most reliable system that can deliver the highest quality care.
It is my privilege to get to visit hospitals all over the country. Carlos, you all and the team here at WellSpan clearly are spectacularly patient-centered in what you do. Thank you again for joining the podcast, and it's been a real privilege to spend time with you.
Thank you very much.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.